Many of us put a lot of strain on our abdomens without even knowing it. Now, if your job requires you to do a lot of heavy lifting, or if you're overweight, or if you're pregnant, or have undergone a surgical procedure, these circumstances can leave you vulnerable to what are called hernias. They occur when fat tissue or part of an organ in your body pushes through a weakened spot in the abdomen. As a result, you may see a lump or even a bulge in the belly or in the groin and feel some uncomfortable pain. Now, this can be alarming for a lot of us, but they're not usually life-threatening. On the program today, let's talk more about why hernias happen, how to spot them, and what you should do if you notice one happen. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. If you experience some pain or tenderness in your belly or around your groin that seem to not go away, you may have what's called an hernia. Now, our guests are here today to tell us more about this condition. With us is Dr. Leonardo Ona III. He's a general surgeon from the St. Luke's Medical Center, Global City. Also with us is Dr. Nicodemus Ong, who is an internal medicine specialist as well as a gastroenterologist at St. Luke's Medical Center in Quezon City, as well as Fatima University Medical Center. Thank you both for joining us on this episode of MedTalk Health Talk. Now, your abdomen is made up of muscles and strong tissue that protect your internal organs. But when these muscles and tissue are weakened, an organ or tissue can squeeze through, giving what's called an hernia. I'll start the discussion with Dr. Ona. Tell us more about this condition. Saan, Dr. Ona, nangyayari karaniwan ang hernia?
Well, more commonly, we see them in what we call the inguinal area. Sa Pilipino, yung singit na lugar, no? The reason being is that majority still is congenital, kung titingnan mo, even for adults, no? Because there is something that failed to close during the embryo stage of the patient. No? Another reason for it to happen is because of a weakness in the wall. When we get older, the walls or the muscles become thinner, and if you have a high pressure in the abdomen, the tendency for that abdominal pressure is to make the intestines or any contents in the abdominal cavity protrude out of the abdominal wall. No? And another is a history of surgery or any manipulation in the wall wherein the weakness of, the strength of the wall is not 100% anymore. So the tendency is for that weak area to give way for the contents to come out and protrude out.
There are different types of hernias which can occur in different parts of your body as well. But the most common type, as mentioned by Dr. Ona, is the inguinal hernia. In fact, 27% of men and around just 3% of women can develop it at some point in their lives. Now, Dr. Nico, let's talk about some of the different types of hernias.
You have external hernias. So you have ventral wall or the anterior abdominal wall hernias, where you have umbilical hernia, you have incisional type, you have spigelian hernia. So you have another type, which is the inguinal type of hernia. So that's the most common type. Then there is also a lumbar type of hernia, where you have the Griffiths and the Petit hernia. Then there's also an internal type of hernia.
Are the symptoms relatively similar no matter what type of hernia?
Regardless of the hernia, usually people will just feel a bulge there. So that's a symptomatic hernia. Sometimes people will feel a slight discomfort on that area. So that's already called symptomatic hernia. So, and then the worst case scenario where it's actually very life-threatening is the incarcerated or strangulated hernia. So incarcerated hernia, that would mean that the abdominal organ that is protruding out to any part or any weakness in the abdominal wall is already irreducible. That means no matter what you do, that abdominal organ is stuck there. And if it's super painful, that's already strangulated hernia. That means the blood supply to that organ that is protruding out is already compromised. That means there is no blood supply. So that is already emergency surgery.
Let's talk about when a hernia becomes symptomatic. Could you explain that a little bit more, Dr. Ona. Does surgery have a role with hernias that have mild symptoms?
Basically, if you look anywhere, the treatment for hernia, especially for symptomatic one, kasi is surgery. But before going there, if you have a hernia, meaning there is a defect and there is protrusion out, the risk for developing symptoms or complication in the future is not that high initially. In the first year, mga less than mga 2% lang yun. But it goes higher as you go along. And eventually, people who have this will have to consider having surgery. No? So going back to the question, may role bang surgery? Yes, the possibility of having surgery for asymptomatic and for those with mild symptoms should be discussed to the patient, because the probability of it becoming a moderate or severe symptom will be higher eventually in his or her lifetime.
Pag-usapan natin yun a little bit more, Dr. Ona, no? Because what you were explaining, an hernia that is beginning to develop, which does not have any symptoms, may progress over time to become potentially a serious situation. Now, what is the main cause for that progression, Dr. Ona?
Well, many things. Number one, as we age, we lose water, the integrity of our tissues, including the layers in the abdomen, becomes thinner. So because of that loss of integrity, its capacity to hold the abdominal contents within its compartment is lesser already. Now, as we grow older also, we also develop some conditions. For example, for those with chronic cough, the pressure in the abdominal wall is increased too much, so that plus the fact that you have a weakened wall, the tendency for you to have a protrusion is high. No?
When we return, we'll talk more about what happens if you find an hernia in your young child and how you are properly diagnosed to have an hernia. We're your partner in healthcare. Keep it here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Earlier on the show, we talked about how hernias occur and what you should do or how to spot it if it becomes serious. Now let's talk about what you should do if you discover that your newborn baby has a protrusion on their stomach. Dr. Nico, let's talk about that. It can be very unsettling for a parent, especially a new parent, na makita nila yung anak nila and they see some protrusions or bumps on them that may or not be normal. Now, could you describe for us what a hernia in an infant may look like and how should new parents approach this?
First of all, the abdominal cavity or the abdomen in an infant, it should be a bit globular. So it's like a balloon. It should be as smooth as a balloon. So it should not have any parang protruding out of any part of that abdomen. So if you see parang a bump or an abnormal protrusion, it's best if you consult your pediatrician. If it is less than 4 years old, the belly button can protrude slightly out. So it should not be more than around 0.5 centimeters, no? So dapat maliit lang siya kung magpo-protrude siya dun sa umbilical hernia. However, if your children is more than approximately 2 to 4 years old na, that umbilical hernia should actually decrease or liliit siya dapat. Hindi siya dapat lumalaki. If the protrusion or the hernia in the umbilical area is getting bigger and bigger, yes, you should get checked to a pediatrician immediately.
Yes, but ang importante dyan for the parents is not to panic right away. It's always good to seek consult to get the correct information. Now, Dr. Ona, kapag merong hernia ang isang bata, is this a concern for the parent to have it immediately fixed?
Well, it really depends, no? For umbilical hernia, as Dr. Nico has told us, umbilical hernias, they do close, no, within 5 years, no? Kung 4 to 5 years old, the hernia is still the same. It's bigger, or it hasn't significantly closed, then the possibility of doing surgery would be there, because the problem with children is that they cry, especially infants. And, when you have crying, the pressure in the abdomen becomes higher. That aggravates the condition. But for umbilical hernia, we can observe unless if there is strangulation as was discussed.
Now, Dr. Nico, we were talking about yung mga bata. Let's talk about the elderly naman because they're higher risk. Earlier, Dr. Ona mentioned also how habang tumatanda, numinipis ang wall ng abdomen. What does this mean and how does this pose an increased risk for hernias, Dr. Nico?
Okay, so patients that are at increased risk to develop hernias as an adult, the risk factors are as follows. So first, older age. So mga elderly natin. Number 2, there is chronic cough. Number 3, there's smoking. And then number 4, some previous abdominal surgery or kung kailan nabukas na yung stomach. That's actually the risk factors or those are the patients that are high risk to develop abdominal hernias.
Dr. Nico, how is one properly diagnosed to have an hernia? Anong klaseng procedures usually ang ginagawa ng isang doktor to have a proper diagnosis of hernia?
Actually, for the diagnosis of hernia, the most important thing here is a proper physical examination. So first, if you see a bulge there, you need to get checked by a doctor. So that doctor will first inspect the area. So tignan natin kung nasaan siya, gaano siya kalaki, napoprotrude ba siya or hindi. Then the doctor will proceed on palpating that area. So what is protruding? Is it an organ or is it fat?
Do our viewers need to take other tests before they see the doctor? An ultrasound, a CT scan, an X-ray, all of these tools needed before they go to a doctor?
Actually, for hernias, you don't need an ultrasound before going to a doctor. What you need is a physical examination first. Then if the doctor needs confirmation on that hernia, that's the time we request for an imaging test. Most of the time, we don't request for imaging test actually for hernia.
Really quickly, before we go to break, Dr. Ona, let's talk about some of the risk factors ng mga may prior surgical procedures. What are the more common ones? And how long after that procedure can one expect to see that maybe an hernia if ever it does happen?
Well, any abdominal surgery, any surgery wherein the abdominal wall has been opened is a risk factor. There is no straight rule as to when and where it will happen.
Now, sometimes hernias can't be prevented, but there are measures you can take to lower the risk of getting one. More on this when we return. Your health is our mission here on MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Men, women, and children alike can all get hernias. Now, you can't always prevent it from developing, especially if this is something that happened while you were being developed. Now, they occur at birth or because of an existing medical condition or previous surgery. But some simple lifestyle changes can help lower your risk of getting one. Now, Dr. Nico, I'd like to ask you, when it comes to preventing not just having hernias, but a lot of diseases in the body as well, we talk about modifiable risk factors. Ano ba ito and how can this help someone have a less chance of having an hernia?
Earlier, I discussed about the risk factors of a person that would predispose them to develop hernias. So these are old age, smoking, chronic cough, and previous abdominal surgery or previous incision. So for age, actually you can't do anything about it. For smoking, definitely you can quit smoking. So stop smoking. Number 3, previous abdominal surgery, yung sa surgical site, you need to take care of it well. And then for the chronic cough, of course, if you have chronic cough, you need to get checked with the pulmonologist. One more thing is that remember that hernias would develop from a weakness of the abdominal wall. So it is also very useful if you would do abdominal wall exercises. So pag isi-strengthen natin yung abdominal muscles natin sa back and sa front, you can actually prevent yung further development or complications of a hernia. And if you know you actually have a hernia, you can actually wear supporters when you're working out to prevent it from progressing. Para at least may isa ka pang layer of protection para hindi grumabe yung butas niya.
So definitely those are good tips in trying to prevent the progression if ever there is that small or mild type of hernia. Now, Dr. Ona, let's talk about some of the treatment options kapag na-diagnose ng tama ang isang taong may hernia. What are usually the surgical procedures done? How is that abdominal wall strengthened?
There are two principles here, no? For children, especially for those congenital causes, there is no weakness of the wall. There is just this persistent sac. So what the surgeons do, what we do usually, is just to get that sac and ligate that sac, and that's it. Because we expect the wall to be intact, to be competent naman, no? But for older people, and especially for direct hernias, and older people who have indirect hernias, what we do is surgery, no? We either open or minimally invasive. For minimally invasive surgery, we perform it either laparoscopic or as of late, we can do it robotics, no? But basically, it's the most common procedure being done are both open technique and laparoscopic.
Okay, so once someone undergoes a repair of hernia, Dr. Ona, what are some of the pointers that you tell your patients post-surgery para less chance ng umulit?
Okay. Number one, of course, they have to guard themselves from getting the pressure high. No, if the patient has a COPD or any lung problem wherein he is predisposed to cough a lot, he has to get good treatment on maintaining the cough not to happen a lot also para yung abdominal pressure niya is maintained. No? Also for patients who have prostate problems, dapat na address nila so wala silang masyadong straining, no. As far as activity is concerned, actually wala, no, because nowadays we employ the use of what we call mesh. These are good material wherein we lessen the tension in the hernia repair. So what it means is that almost 100% yung tensile strength niya because of the improved tension, no. So kung ano yung activity niyang ginagawa dati, we expect him to be able to do that activity also.
With that, I'd like to thank you, Dr. Leonardo Ona III and Dr. Nicodemus Ong for being with us today and sharing a lot of information when it comes to hernias. We appreciate your time and your expertise very much. I'm Dr. Freddy Gomez, and thank you for watching Men Talk Health Talk. We'll see you again next time.